key takeaway message is that a multidisciplinary coordinated care team is vital in providing care for women with hereditary cancer risk. I'm Dr. Mary Malhili. I'm a gynecological oncologist at Cleveland Clinic, and I'm an associate professor of surgery at the Cleveland Clinic. I have a wonderful team of providers that I work with in the breast health center, as well as genetics and psychology, as well as women's health, that are dedicated to care of women with hereditary breast and ovarian cancer risk. The title of our paper is A Comprehensive Care of Women with Genetic Predisposition to Breast and Ovarian Cancer, and it will be published in the April issue of the Mayo Clinic Proceedings journal. In this paper, we provide a comprehensive review of the care of women with hereditary risk for breast and ovarian cancer. These patients have special considerations and require nuanced care. The study was designed, or the paper was designed to aid practitioners in identifying women at risk for hereditary syndromes, provide counseling on medical and surgical risk management, as well as issues related to fertility, sexuality, menopause management, and psychological support. Along with highlighting the importance of multidisciplinary team care in managing these patients, we outline evidence-based guidelines for early identification of genetic carriers, screening, surveillance, and provide specific guidance on counseling regarding risk-reducing surgery, including bilateral salpingo-oophorectomy and risk-reducing mastectomy. We describe the approach in managing premature menopause, the psychological aspects associated with high-risk breast and ovarian cancer care. And since the genetic landscape is evolving and the complexity of testing is increasing, the role of genetic counseling is crucial in the care of women at high risk. With more genes being identified and variability in risk associated with each of the genes, it's important to know how each gene may affect patients and their family in a different way. For a general practitioner or OBGYN provider, the common concerns that patients face when it comes to making decisions about risk reduction are related to cardiovascular risk, bone health, sexual health, as well as emotional and psychological health and detriments that can be associated with having a diagnosis of being a carrier of a genetic mutation. From a clinical practice standpoint, we describe how a clinician would go about identifying high-risk women and the value of educating patients regarding their risk reduction options, as well as identifying other family members who may be carriers of the genetic mutation. We emphasize that there are certain red flags for testing, including breast cancer diagnosed under the age of 50, triple-negative breast cancer, multiple primary cancers, male breast cancer, ovarian cancer, pancreatic cancer, or metastatic prostate cancer, as well as Ashkenazi Jewish ancestry. Similar to other large centers such as Mayo Clinic, we have established a multidisciplinary team to care for patients with inherited predisposition for breast and ovarian cancer. And we recommend that women be referred to specialists with expertise in counseling and dealing with the multiple dimensions of care and the medical issues associated with having a genetic mutation and risk-reducing effects. For patients, this means that they have access to specialized care and being able to get the most up-to-date information regarding risk to ensure that they have a dedicated team that is able to recognize their holistic needs and provide them with their needs so that they can make the best decisions and continue to live healthy lives going forward. In summary, this article gives an extensive review of the risk prevention guidelines and the holistic care of women with inherited risk for breast and ovarian cancer. Please read the article if you're interested in learning about how to care for this special population of patients.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.